Okay, so I've come into Rupinder's room. Knock, knock, knock. It's hi Rupinder, I'm Suzanne. I'm going to be your nurse. I would wash my hands, of course. I'm coming into his room, and I would use my notes that I've made on my cheat sheet and my MAR, and I will ask him his name, and he says Rupinder Appendi. Rupinder Appendi is what I see. Rupinder Appendi, and it's Dr. Jensen. Dr. Jensen. He's in room 319, and I'd ask him his date of birth, and he states it's October 1st, 1982, and that's what it says on his identifier on his bracelet, as well as on his MAR, so we know that is correct. And I would say, Rupinder, I understand you have an allergy. Can you tell me what you're allergic to? And he states he's allergic to peanuts, which matches what I have, so I would make sure that the dietary people are aware for his diet. It doesn't really affect the med we're giving, but it's good to know just in case some have any kind of peanut derivatives in there. I've also partially assessed his level of consciousness. He is talking to me, he is awake, he is alert. I would ask him, do you know where you are? And he states he's here at the hospital. And do you know why you're here? And he states he just had his appendix out. So we have confirmed his level of consciousness, which is good. And I would check his vitals. That includes his respirations, his SpO2s, his blood pressure, his temperature, pulse, everything. And all his vitals are good for the sake of this video. I would ask him to tell me about his pain. Is he having any pain? He states he is, and it's at the site of his surgery, which is not uncommon. And he does, and I'll ask him, can you rate your pain on a scale of 1 to 10? He states it's about 5 out of 10. And I ask him what makes it worse or better, and he states, well, about 15 minutes ago, he started moving around. He felt kind of okay when he was coming out of anesthetic, but about 15 minutes ago, he started feeling sharp stabbing pain when he was moving around. So we know that as he's coming out of that anesthetic, he is going to be in a little more pain. So he's told us all of that, which is great. I would wash my hands before I touch him. And of course, I would document all of this on my sheet as he's telling me. So I know that his pain is 5 out of 10. And I do know that the pain is at his site of surgery. And it started about 15-20 minutes ago. And I would ask him if he's nauseated at all. He states he is not at this present time, but I would still make note of that as well. And I would, so Rupinder, we're just going to put in a little med line, and what it is it's a little needle that we're going to put with a line, so we don't have to keep poking you every time you're in pain. We would assess the site, which is right here on his right arm, upper arm, and we would make sure that there's no rashes or lesions there, that everything was clear for us to put that med line in, and it is, as it appears with Rupinder. So Rupinder, I will be right back. I'm just going to get your med, and we will be sure to administer it for you.